He has helped my low back an incredible amount. I only have few episodes of pain. I have a permanent condition in my low back of a herniated disc. And because of Dr. LeBlanc's treatment, I'm able to function much better now. He is an excellent doctor. One of the most important things about selecting a chiropractor is to have trust in the person, the doctor that you are going to. And I trust Dr. LeBlanc with my body. He was a student of mine. I've seen his work. I've helped train him. And I would send my mother to go see Dr. LeBlanc.
Hi, my name is Jean. I'm a 66-year-old retired nurse who had a lot of back and leg problems. Until coming to see Dr. Kyle, he has done wonders for me. I am doing things that I haven't done in years. I go to 2 water exercise classes, which also is recommended by Dr. Kyle. I feel great. You need to come and do these treatments.
I met Dr. Kyle, and it kind of helped out because I started talking to him, and he told me exactly what he was about. And it happened to be that I had some issues as far as back pain and neck pain, and he told me of a way he could help to straighten me out without using medications, and I'm not a big medication user. He's gotten me to where my range of motion, as far as the way I could turn my head left to right without it hurting my back, I could bend down, touch my toes, and nothing's bothering me like it was before. And I feel like I'm 25 again, and I'm able to move around. I've got 2 kids. I'm able to actually enjoy being with them, and I mean, stuff that I was slowing way down on, I'm back up to where I was before. I mean, I have no complaints. This has just been fantastic for me.
Welcome back to Phenomenal Health. Here's your host, Dr. Jeff Hawkins.
Hi, welcome back to Phenomenal Health. I have with me Dr. Kyle LeBlanc today. We're talking all about why chiropractic has become the most popular non-surgical treatment for pain in the United States. Now, doctors, into our last break, we had the next trivia question, which was, can medical doctors do what doctors of chiropractic can do?
They absolutely cannot do what we do. In the same way that I'm not trained to do brain surgery or cardiac surgery, I lack that specific training. Medical doctors absolutely lack the training that we have. We are biomechanical specialists, as I said, and we are the source for mechanical, low back pain, neck pain, or any type of spinal problem.
Okay, so it's just a different specialty, just like dentistry is or optometry.
Absolutely.
Okay, now do people need a referral from their medical doctor to go to a chiropractor?
No, they don't. In fact, if you have a spinal problem, a chiropractor is the first place that you should actually go.
Okay, now is chiropractic covered by most insurance companies?
Absolutely. We actually have gone so far as to become preferred providers for most of the insurance companies in our area to make it that much easier on our patients.
Okay, now how safe is chiropractic, doctor?
Chiropractic is extremely safe. In fact, it's the most, or the safest method of healthcare on the planet, where we as healthcare providers pay less as a group as chiropractors than any other profession. We simply don't hurt people.
Okay. Now, what can happen to someone's spine throughout their life if they don't take care of it properly?
Well, I'm glad you asked me that question because this is actually a topic that I lecture on quite frequently. Arthritis. Now, arthritis is characterized by joint inflammation and bone degeneration. Now, it's more commonly considered DJD now, degenerative joint disease, because it more accurately depicts what happens in the body.
Okay.
As you can see, the spine is either in 2 forms. It's in a state of health and wellness, or a state of disease and degeneration. Now, here we have the spine in a state of health and wellness. And as we see, if there's a problem that occurs in the body that remains unfixed, it remains in the body, it changes the actual structure of the body. Now, the body will remodel itself to actually change and stabilize, where it actually has more bone occurring to help to actually fixate that segment, take the pressure off that segment and draw the pressure to other areas of the body. It will change, and oftentimes what you end up seeing is when you get to this level with all this extra bone being laid, you actually have less space for the nerves to travel out and more pressure on the nervous system. So it's actually something that we as chiropractors like to maintain proper form to then promote proper functioning as well.
Okay, so it looks like, I mean, when you go to a dental office, you'll see the different stages of tooth decay. That's very similar, it looks like, to what happens where you have a healthy vertebrae, and then with time, if you don't take care of it, it breaks down into a disease state like you're talking about. It looks very similar to that type of thing.
Extremely similar.
Okay, so then how does chiropractic help prevent that from happening, like those final two stages?
Sure. What we do is we promote proper form. We take the pressure off of these nerves. We realign the body to actually promote proper functioning. If we can return the body to that state of health and wellness, we've eliminated this disease process from perpetuating or continuing on and eliminating it from further degenerating over time.
All right, so then pretty much what you're saying is you can pretty much prevent those further stages as long as someone keeps their vertebrae lined up properly throughout their life. Then a lot of that degeneration can be eliminated?
Absolutely. What we're able to do is, if we actually have a normal spine, we're able to promote and maintain that normal spine. If we have someone who's come in and they're degenerated along the way, what we try to do is we try to prevent further progression of the degeneration. We may not be able to reverse anyone who's in one of the later stages to get them back to normal, but the idea is to prevent any further progression of that problem.
Okay, so doctor, we're kind of running out of time, so why don't you summarize for us now exactly how chiropractic can help with different types of pain in your body?
Sure. Chiropractic helps with many different types of pain, aches, pain, radiation, tingling. There are many different symptoms, and we as chiropractors understand what those symptoms mean and where those problems occur. We can actually help to correct those problems and return a person to normal functioning.
Okay, so Doc, what is the one thing you want to leave people with that are watching the show tonight?
I think the most important thing to leave people with is that pain is not a normal problem.
Okay.
People accept a lower form of health as being acceptable in this country, and it's not necessary. 1 in 6 Americans suffer from headaches, chronic headaches. So what we like to say is, please do not accept a lower form of health as being acceptable. It's not necessary. There are treatments available that are very successful treatments that can actually help to get you back to normal.
Great. Doc, I really appreciate your time. We're out of time right now. I want to thank you for coming on, explaining all this to the people out here in the St. Louis area. Will you come back on again and talk with us more?
Absolutely.
Thanks,
Thank you
Doc.
very much.
I appreciate it. Thank you.
Appreciate it.
Now, I encourage everyone who is watching tonight to call Dr. LeBlanc's office and make an appointment for a checkup. You could be suffering with pain right now needlessly. As a doctor of chiropractic, Dr. LeBlanc has special training at correcting spinal problems that cause pain. If you've never gotten a spinal checkup for yourself, you need to call his office and make an appointment. When you call his office and mention you saw this TV show, he will give you a complimentary consultation, exam, and computerized spinal scan. This analysis has a value of over $250, but Dr. LeBlanc is giving it to you as a gift for watching this show. It is possible to have spinal problems and not know it. Call his office now before it's too late. I want to thank you for watching this edition of Phenomenal Health. Have a great day.